Okay, today at this point, you should have a list of things that you have currently been diagnosed with, as well as things that present what I would call a red flag. So, have you been diagnosed or have you been on antibiotics for a prolonged period of time, even in your youth? So, like, did you suffer from chronic ear infections? Did you have acne? Did you have asthma? So, those are things that sometimes require prolonged use of antibiotics. Why do we care? Well, that predisposes you to have less good bacteria, which opens the door for fungal overgrowth and overgrowth of pathogenic bacteria. Have you been exposed to mold? Remember, we talked about that. Do you have high levels of environmental toxins? Do you suspect heavy metals being an issue? Do you suspect or do you know that you have an autoimmune disease, either because you've been diagnosed with it or because your parents or siblings suffer from an autoimmune disease? Do you think you might have an underlying viral infection like Epstein-Barr? Um, do you suspect food sensitivities? Like, do you get bloated? Do you get gas after certain foods? Do they give you indigestion? Do you suspect fungal overgrowth like Candida albicans because you have chronic yeast infections or because your tongue looks white when you look at it or it's coated in the mirror? Do you suspect leaky gut syndrome? Do you think you might have small intestinal bacterial overgrowth? You would suspect that if you eat and then just feel miserable. You're bloated and gassy. Your stomach is extended. So at this point, we take what we have learned through your health history, which we went through in the video before this. We couple that with what we suspect from your symptoms, which was from your metabolic assessment form. Then we want to confirm our suspicions or rule them out by doing the advanced laboratory testing. And this is an absolutely vital element of the functional medicine protocol. Once we get our testing back, we now know what the underlying aggravating factors are that are driving your health condition. We're not guessing anymore. Again, once we get the test results back, we're able to develop a personalized functional medicine treatment protocol that's designed specifically for you and no one else. If we don't get the advanced laboratory testing completed, then we're basically assuming that all of the things I just mentioned are problems for you so that nothing gets by us. So we have to make a bunch of assumptions, which actually makes our treatment protocol pretty large and a good bit more difficult. That would mean we have to do environmental and heavy metal detoxification. We have to assume that you have candida overgrowth and pathogenic bacteria. We have to assume that you have some standard food sensitivities. So it is always best to do the testing. Now, if you want help with this laboratory testing, I'll be glad to talk you through the process of determining which laboratory tests would yield the most information for the least amount of money. And unfortunately, your health insurance does not pay for the testing. It's important to run the proper tests. So if you want me to walk you through that process, simply ask me for help, either by direct messaging me on the Skool platform or even on Facebook. You can call my office directly at 800-939-2948, or you can go to talktodrd.com and schedule your own consultation. But in the next video, I'm planning to show you an actual case study, which includes the testing that we did for this particular patient. So, what is the next step for you? Well, of course, you want to watch the next video. You want to stay up on this, but the advanced laboratory testing is the step that you really want to take if you're looking for relief. Anyway, I would love to help you. If you need my help, go ahead and do what I mentioned. Otherwise, watch the next video.